Okay, you guys all ready?
Yeah.
Call this meeting to order. Please stand for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, this is Porter County Board of Commissioners meeting. It's November 17th, 2020, a little bit after 10 o'clock. We're going to move right into the consent agenda. Melanie?
Approval of payroll October 2nd and October 16th, 2020. Approval of claims October 1st, 8th, 15th, 22nd, 29th, November 5th, and November 12th, 2020. Approval of minutes September 29th, 2020. Treasurer's monthly report filed September 30th, 2020, and October 31st, 2020. Weights and measures monthly report filed September 16th to October 15th, 2020.
Thank you, Melanie.
Motion to approve consent agenda.
Second.
We have a motion and a second for consent agenda. All those in favor signify by saying aye.
Aye.
Aye. Pose same sign. Motion carries. We have no announcements, and I don't think we have any new business. We're going to start off here with the Commissioner's agenda here. We're going to have a COVID update from Dr. Stamp from the Health Department. So, Dr. Stamp, welcome. Good morning.
Thank you. Thank you for
You have the
having
floor.
me. Okay. So I'm here today to give you a COVID update of what's going on in Porter County and information on the new executive order that was released last week. This is the reason we're here today. If you look at the graph, that thankfully has been provided by Kurt, who's been doing a great job of keeping our dashboard up to date. That's Porter County or porterco.org. You can find a lot of information there. I'll talk about where I get my information a little later. What you're looking at is a graph of weekly cases that is averaged daily, or that's a rolling daily, per 100,000 in Porter County. We use 100,000 as opposed to the actual population of Porter County so that it can be compared regionally and from county to county without thought to the actual population. So if you look at this is not the entire time we've been dealing with COVID, which has been 8 months now. This actually goes from September to last week. And middle of September, we were looking at about 120 cases a week of new cases of COVID. Last week, we had 1,200 cases of COVID, new cases. So about 6 weeks ago, we had a huge increase in cases, and it is just continuing to climb. So that's where we stand today. Next slide, please. Where I get most of my data comes from our own website, porterco.org. As I said, Kurt's been doing a great job of maintaining that tirelessly for the past 8 months. He gets his data from us and the state, us at the Health Department and the state. The state's website is coronavirus.in.gov. They have good information, which I'll show you in just a second, about how we compare with other counties. So that's what I use a lot there. That also is where the long-term care dashboard is, and the school dashboard. So all that information is available to the public, cases in the schools, cases in long-term care facilities. I also use the Regan Street Institute's website, which gives us hospital data. And that's linked from the state's Department of Health website, too. So that's been very helpful also. So next slide. This is a sample map of the coronavirus.in.gov, the State Department of Health's website. This is they've been maintaining this color-coded county metric map for about the past, I think, 6 weeks or so. It is updated, the map is updated weekly on Wednesday, so it is behind about a week at a time. As if you look at our county's information on our dashboard, it's a little bit more up to date. They use two metrics to determine the color level of risk. They use that weekly cases per 100,000 residents we talked about before, and the 7-day rolling all-test positivity rate. We last week, so this is from last week, previous week we were in orange. Our total cases, our weekly cases, had been in the red level for a number of weeks. But then last week, our positivity rate climbed above 15%, which put us all in the red. So tomorrow, our county will be highlighted in red, as I assume many counties across at least northern Indiana, probably throughout the state, are going to be in the same situation. But that'll be interesting to see. So that is from coronavirus.in.gov. There are links on that website and on the county website to testing sites and registrations for testing. So that's also quite helpful. All right, next slide, please. Hospitalizations have been a big issue, and if we're going to have increasing cases, we're going to have increasing hospitalizations. So if on the left side, if you look at all cases of COVID in Porter County, 15% of those who are diagnosed with COVID are sick enough to seek medical attention in the emergency room. 7.2% of all those with COVID end up being hospitalized, and then 1% of all those with COVID end up in our ICU. Those are specific to our county. And then if you are hospitalized, and this is for the state, on the right side, if you are hospitalized with COVID, and this is Indiana, this is not around the world, this is not the United States, you have an 11% risk of mortality. So death rate is 11% in the hospitals in Indiana. And that is all, I think that is in total from the beginning of this pandemic to now. So now, hopefully it's a little bit better, but this is kind of as we've been going all along. The average length of stay in an ICU, if you're hospitalized with COVID, is 8 days, and the average length of non-ICU stays is 10 days. So if you are in the ICU with COVID, you're looking at a month or potentially in the hospital or more. The hospital's getting much, we around the country are getting much better at treating COVID cases in very sick patients. Antivirals and steroids and proning, turning patients over to help them breathe better. Those things are, and now we have monoclonal antibody, which was just recently approved, are very hopeful. So patients are being discharged sooner than they were in the past. The current census at Northwest Health Porter, previously Porter Regional Hospital, as of yesterday, they have 2 COVID units with over 60 patients currently hospitalized with coronavirus. They have 20 current ICU beds, and 10 of those they are full as of yesterday, and 10 of them are taken up with COVID patients. 5 of those COVID patients are on ventilators. So we think a lot of times that COVID is not, maybe gives you the sniffles. Many people don't have symptoms at all, but there is a portion of patients that get very, very sick. So next slide, please. Our long-term care facilities in Porter County, of the 16, so on the state dashboard, of the 16 facilities that are reporting, which is most of them in Porter County, these are nursing homes and rehab facilities. 10 of them have had outbreaks. Our largest outbreak in one facility has been 80 cases at least. And that actually was fairly recent over the past month to 6 weeks. There have been 6 facilities that have had deaths. And of the 70 deaths that we have had to date in Porter County from COVID, 45% of them have been from long-term care facilities. So these people are really vulnerable. That 65% of our deaths have been attributed to nursing homes and rehab facilities. They can't leave. They are exposed to you don't have a choice of who you're exposed to. The state is working really hard to work with nursing homes to get them the support that they need. Most nursing homes, I think all of them in Porter County are required to test their staff twice weekly. And so and then the Indiana National Guard is at many of the nursing homes in Porter County to help with manpower and staffing type things. So that has been helpful. And then not all of the long-term care facility residents with COVID end up in the hospital, obviously, but many of them do, and then that directly stresses our hospital also. So the reason I give you that background is to let you know that this is the reason that the executive order was released yesterday. So next slide, please. The executive order 2048 was published last week, started on Sunday, goes through December 12th. There's a link to it there. It has general requirements, which have not changed from previous orders, and maybe a little bit more specific. And those are basically individuals, businesses, schools require masking and social distancing and increased sanitation and hand washing. And then there are specific requirements in this executive order based on the color-coded risk level. Next slide, please. So the restrictions that are new, that are based on the color-coded risk level, if we are at an orange level, all gathering and events are limited to 50 participants. Gatherings are groups of people from households that are not, from a number of households for the purpose of social interaction. So parties, weddings, funerals, whatever, those kind of things. An event can be commercial, it can be educational, it can be civic. It is more to attend something that you're doing something at. So it can be fairs and markets and conventions and those kind of things. So that just tells you a little bit that gatherings and events are similar but slightly different. In the red level where we are, we have restricted the order restricts gatherings to 25 participants. Anything needing to be more than that needs to be approved by the health department, and a request needs to be submitted at least 7 days prior to the event. I'll tell you right now, we are not particularly inclined in our current situation to approve events and gatherings of many more than 25 people. Within those 25 people, they still have the masks and the social distancing, and the plan for safety still needs to be in place, even with the 25 people. So in the executive order comments, so for businesses and other entities, common areas and break rooms, they want people to minimize use. It does not have them closed in the actual executive order in red, but when the State Department of Health has been talking about it over the past week, they really recommend break rooms being closed. Certainly, social distancing is really important there. When people eat lunch together at common tables, that's, their masks are off for generally more than 15 minutes, and that increases risk. School events, those are, anything from sports to concerts to other club events are in orange restricted to 25% capacity. In red, they are restricted to parents, guardians, siblings only. I'll tell you, I'm working with the schools to even minimize that, depending on space. You get parents and siblings, and you have, potentially an additional 4 to 6 people per participant, and we're really encouraging the schools to limit it to 2 or 3 spectators within that category of parent, guardian, sibling. Sports clubs and leagues are still allowed to play in red and orange with spectators limited to parents and siblings and or dependent children, depending on the league. And senior centers are closed. Next slide, please. The requirements for the health department in this executive order are that we continue to look for common threads or outbreaks, and that we work with community leaders to help identify areas of risk and things that we can do to slow the spread. And one of the specific things to consider for health departments and local governments is to consider limiting hours of operations for bars, taverns, nightclubs. We know that when people gather for longer periods of time in places where they don't have their mask on, and especially when alcohol is involved, the mask tends to come off and people tend to lean in and the risk goes up. So that is an area where we may need to evaluate in the future and consider. Then the state is offering grants to local governments, $20 million total for the state of Indiana for education, awareness, and enforcement. So that funding is potentially out there for us.
Does the health department have any plans of going after some of that money, or do you?
I'd really like to. In the order, it does not specify that it's coming directly to health departments. So, yeah, so we will work with the county to try and get some of that.
Yep.
Yeah, absolutely.
Thank you.
Mm-hmm. Next slide, please.
Vicki, did you hear that?
Oh, absolutely. I heard it the day the governor said it, yes.
Okay. Next slide. All right, so this is the first executive order that allows for actual enforcement of these requirements. We have always had authority over food establishments from the health department standpoint, but we have not over other businesses and entities. So this gives all businesses and entities fall under this. With the first offense, we'll be issuing verbal warnings and giving education as to how they can comply and make their practices safer. The second offense will be a written order to cease the unsafe practice, and the third offense will be a closure order. Closure orders then are required to be reported to the Secretary of State and any applicable licensing or permitting board for review of the business's license. And then the county prosecutor may be involved also when it comes to that level. We, in the past month, have onboarded 2 additional staff to help with event monitoring, and they were taken, we stole those from furloughed county, I believe it was the Opera House. They have been very helpful. And then we are also looking at hiring some additional help with monies from the CARES Act and monies from the grant that we could use for inspection and enforcement. More coming on that later, in the future, I should say. Next slide, please. Where the health department is continuing to work is working with faith communities. Churches are, specifically religious organizations, are exempt from the executive order, but we do know that that has been an area of risk, has been worship services and church-related activities. So we've been trying to work with churches, directly with churches and getting the word out for best practices, even though they do not necessarily need to follow all these guidelines. It really is so helpful and makes it so much safer if they can socially distance in their services and keep their masks on through services, through singing, those kind of activities. So we've been working directly with churches on that. Gyms are very variable in terms of how the safeguards they've put in place. Where we have our greatest concern is open gyms, where people like pickup games, basketball, those kind of things. We are going to be treating those as gatherings or events. So open gyms and basketball games and such will be limited to 25 people in red, and they will be required to wear masks when they are not actually playing ball. So trying to keep things safe that way. Gyms, pickup games tend to be very social events. And then we've been working with businesses also to help with, we get a lot of calls asking for advice on their plans, and we've been working with businesses trying to help keep them safe. We continue to do contact tracing where we can, and when the state cannot keep up, it's been hard from both our aspects to keeping up with contact tracing when we have over 200 cases a day. Testing sites, we've been running for the past month, I believe, Valparaiso and Portage. We're planning on about 100 tests a day. We have been running over that very regularly. Our largest date so far was at the Valpo site where we tested 220 people. And most labs currently have about a 4-day turnaround because of the increased demand in testing. Labs are really stepping up to the plate and keeping up with stuff, but it is not as quick as the 2-day turnaround time we were seeing back in September.
Dr. Stamp, I have a
Yes, sir.
question. I noticed some photos out at the Valpo testing site, and the lines obviously were getting long because there's more testing going on now. Is there been any thought or consideration to, maybe before people come into the testing building, it's getting colder out now, and have we given any type of consideration to putting up a tent or putting up something that we could sort of have the lines weave around inside rather than outside? Because I think that's going to be problematic over the next 3 months, because I know we're supposed to be getting a tough winter this year, so I don't know if people want to be standing out in the tundra for
Exactly.
20
Right.
minutes.
We are looking into ways to decrease the lines. There are a couple things that we've done. So initially, the state scheduling site only had half-hour blocks of time, and they would have allow 12 appointments to come any time in any half-hour block, starting on the hour and the half-hour. So we would have 12 people show up at 8 o'clock. And then, they have to wait for a while. Really, if people are registered beforehand, having answered all 25 questions and saying they were registered and set up with a time, and it doesn't even need to be the time that they come in, but if they are fully registered, it takes them about 4 minutes inside the building. Really, we are, turning people in and out, taking the test quite quickly and getting them home, which is nice. If they are not registered, that registration, while they are standing there or waiting, can take upwards of 20 minutes. So that's asking all the demographic questions. If they're standing there with the registrar because they don't have internet access or whatever, they don't have a smartphone, that kind of thing, and the registrar is just typing in the information as they're taking it, that significantly increases the time that they're in the building. We really are encouraging people, even if they come in and they have a smartphone and they're willing to do it, go back to their car, register, go through that whole process in their car where it's a little bit warmer, register for their time, and then come back up and get in line. So that's one thing. The other thing is that 30-minute time slot. We have had the state, they've been willing to work with us on this, make 15-minute time slots. So what we do is we have 15-minute time slots with, I think, 4 or 5 people that can sign up for each 15-minute slot. That just spreads it out a little bit, because if we have a bunch of people lining up at 8 a.m., and we get them through, really in 15 minutes, it looks like a very long line, but if we can have, 5 people come at 8 a.m. and 5 people come at 8:15, then people are not standing in line as long. So that's been very helpful to break it up into 15-minute segments, because then we're also not standing around for 15 minutes at the end of that half hour. The other thing, and then we have limited that a little bit. It was 12 per half hour. We've dropped it down to, I think, 8 or 10, because we're seeing in Valparaiso, about a third of our people that come to us are walk-ins. Maybe have registered but have a time tomorrow or the next day, or haven't registered at all, and we're having them go back and do that registration. So that's
Is some of that
part of how we're-
information that we're putting out there, where to go and all this stuff, is that prominent, that they need to register first, and they need to, just wanting to make sure that we're doing everything for the people?
I believe so. I believe we've got it all on our website. And I think just word of mouth, they get out, they'll take walk-ins, which we will. Yeah, absolutely. So there is that. It really helps to be registered first. We've looked into some options, do we need those little buzzers from the restaurants? Do we need the callback numbers from the restaurants so people can wait in their car and keep in line? we're evaluating some of
Okay.
those options to minimize lines. Yes, as it gets cold, that's not a fun place to
You
be.
can see it coming.
Absolutely.
You can see it coming.
Right, especially if you feel
Well, I have a question. I was, I'm going to be honest, I was shocked when I saw the photograph of people standing outside in the line. I didn't know we were going to be doing it that way.
Mhm.
I don't know how we could expect people who are sick to be standing in a line, waiting, a long line, no less. With the properties that we have, the size of the Expo Center, I know we have a building out there. Why aren't we asking people to come out of their car?
Right, so, the picture, let's talk about that a little bit. Letty, can you tell them about where that picture came from, what was different on that day? Do you remember
Well, actually, I
the
went
situation?
there that day. Unfortunately, when I got there, and I went as soon as I could, the line was not that long. It was maybe 12 people out there. But one thing that we have incorporated is that we're asking people come to our door. We have signage out there that shows the link, so they can register ahead of time. The problem we're having is people don't want to go to register, or they have a problem, they don't understand the whole process. And so that's why we have the long line. So we try to get those that are already registered come in because they already have a time schedule. We have staff that's actually out there trying to help them register. But what we've added to avoid having people standing outside is that we take their names, numbers, and then when we're ready to bring them in, we call them while they wait in their cars. That way they're not out in the open. And so that's one thing that we've added to kind of help out with those.
Well, Letty, what I don't understand is other hospitals, Great Lakes is another example, they're receiving people in their vehicles.
Right.
They are not asked to leave their vehicles. They don't want them to leave their vehicles. That's for their safety, for the tester safety. Why can't we do that?
We have 2 swabbers, so you're asking that we take our swabbers to go outside and test the people out there in the vehicle?
Well, they come in, have the cars drive into a covered area. The swabbers receive the vehicles, next car.
Maybe
They
how
probably
we
do
saw
two cars.
employees at the beginning of all of this, remember how we...
Sure, right, yeah. Something like that can work well if they're well-registered beforehand. As soon as you have a car drive in that has not registered, then that's 20 minutes of the exhaust kind of building up down the road.
But that could be...
So that would be a that
Yeah, Dr.
certainly could be a
Stan,
possibility.
right,
We did the
and-
drive-through before.
Those cars that are
Oh,
not,
we did.
those vehicles that are not registered, they're asked to lead the line.
Mhm.
Then
Well,
they're
you
taking...
have 2 lines.
Right, then they're taken care of.
Right.
But here's my fear. Once it really gets bitterly cold, or in those days where it's raining heavily, we can't have people standing outside.
No.
We can't.
I mean,
And that's
we would
going,
love to
and
have
that's not only,
people-
not only for that reason, it's also going to prohibit our ability to test as many as we would otherwise been able to test had the weather been cooperative. So, if we can redesign this in some way where we're not getting people. When people leave those vehicles, they are now a threat. They're a threat to the people they're standing next to, because the odds are that person they're standing next to, it's the odds, they're not infected. But when you have people who are not infected standing next to people who are infected, who are sick, we see people that are just, really sick. And I can't imagine asking them to stand outside of the car and stand in a line.
So that is something we certainly can look into at the Valpo site. Obviously, at the Portage site, we don't have a drive-through capability. But that is something we absolutely can look
Yeah,
into.
it's not a criticism,
I
Dr.
would
Stan,
like-
it's just, this is all new to all of us.
Absolutely.
And I'm just throwing this out here as something maybe we can improve.
I don't know exactly when that picture with the line was taken, but there's also another factor that played into that, and that when the state set up our template for scheduling, they initially set it up with the hours skewed an hour. I don't know whether it was an Eastern Central Time issue but they had it set up for like an hour prior, and our staff wasn't even there yet. And so we had like an hour worth of clients waiting at the time. So, that might be when that
And that could be.
when that picture was taken
I'm
too.
just still
Our lines
getting the
really
fact
haven't been that
The
long.
winter is coming, and I don't think we want sick people standing in line. One of the things
Yeah.
that I would like to challenge the health department, and I know it's probably not the right time to be challenging you folks, but, you know, the commissioner's office here in Porter County government has taken the lead on social media in getting this information out, and I really feel that it's time for the Porter County Health Department to stand up and have a social media presence with a Facebook page that can push out some of these announcements and can push out, you know, with this thing in the car, why can't social media have a link to it? I know, you know, Kurt has taken on a lot of the heavy lifting in the messaging from you guys, and I know you're looking at Laura, but this is something that's needed. And we've been pushing other departments in county government to become more of a social media type advocate. And I think that seeing that coming from your health department is a little more official. I know Porter County government's official, but I think you know, it's on the website, but I think that there's a lot of things that you can do through social media to make it easier for the consumer. If they have to sign up for something on their phone, it's a link now. They're just pushing a button. It's a link, right? And so social media is where a lot of this is going. I'm not looking for it to tell a story. We're looking at it to push out information. And with all of our other social media pages that we have in this county, you know, Memorial Opera House, Expo Center, Animal Shelter, we can share a lot of this stuff out there for the health department where people can like it. And now you have a body of people that you can push out information to quickly. And I think that that's one of the things we were going to get to with your department at some point in time. I'm not asking for this to go all happen tomorrow. I'm just throwing this out here something because I think where we get a lot of times, it's just getting that message out, right, and clean and clear, and where can I go to? And the website, as you get on our website, it's confusing. There's a lot of information on our website, even though we have some buttons and stuff we can push. But I would really like to challenge you guys in a nice way, to challenge you to, I think that's something we need to start developing and put a face on that for the Porter County Health Department.
I agree, Jeff, and I think that's,
Excellent.
I think you'll see that's for your benefit as well as the
Yes.
consumer.
I actually really appreciate that encouragement. We've talked about that a lot in the health department.
Anything we can do to
Okay.
help you to set that up, because we just had a 20-minute discussion with our stormwater department this morning, and if you've seen that, we're starting to become very more active on social media, trying to educate about stormwater.
Well, and it's
Well, then-
already helped with highway.
And it's helped with highway, so we're
It's been
we're
great.
looking at it as a tool for you to help communicate to the masses.
And if you have a link to your
Yeah.
survey that people need to answer, you can pin it to the top of the page, so it doesn't just keep, scrolling off, it's always right there.
So we can help with that.
Excellent.
We
Thank
can
you, I
help.
appreciate that.
And I would think that some of the federal monies coming in for COVID, we could put toward that.
Yeah, I suspect so. Yeah, I'll be looking into that. Thank you.
Just the
CARES Act.
one of the, yeah, CARES Act, yeah. But that's just a suggestion, and like I say, it's something I think we should look towards in 2021 to
Happily.
make that happen.
Yeah, that would be
So
great.
Just a suggestion.
Thank you.
And I just, I'm going to speak for myself. I think that your department has done a great job up to this point. Now, not everybody would agree with that. But if people understood what your responsibilities were pre-COVID compared to today, you've done a great job. You really have. There's been some bumps, but there's been bumps everywhere, including our office. But, I think you've all done a great job under the circumstances.
Thank you. Yes, this is the biggest pandemic we've had in 100 years, so none of us have been around to see the last
No.
one, and
And
it's
you
a
know
very
what?
different situation.
What really stands
today.
out more than anything is that, and I think we all learn this with each passing day, not everybody's going to be happy with our decisions. But I hope everybody understands that we give our opinions and make our decisions based on the greater good of everyone. And, that may be hard to understand if you're sitting home in your recliner and you want to go to a bar. I get it. We all get it. But we don't have that luxury up here to cherry pick who we're going to take care of and who we're not. So.
Thank you. Just a couple more slides.
Yep,
Here. Sorry about the how long this takes.
We digress.
It's a lot.
So, possible areas of future modifications to, or additions that we could add to the order. Capacities, limits and hour reduction for food and drink establishments, we touched on that. Capacity reductions for gym and fitness centers. There's been some talk around the state about limiting hours of alcohol sales. And then further potential capacity reductions in gatherings and events. And then, as we talked about, we have the ability now for enforcement. Hopefully, closure is enough of an incentive without fines. So these are all still potentially on the table if things get worse and we are just not catching up with this. But hopefully, these won't be necessary to take further. Next slide. There is hope. So there are two very promising vaccines that have been announced in the past. Their preliminary data has been announced in the past week. One we may have before the end of the year. It won't be available. Neither of them will be available to the general public until probably mid-2021. They are both two-shot series. One is 3 weeks apart. One is 4 weeks apart. And the priorities keep changing. The most recent one I heard was that our long-term care facilities are going to be the top priority for the vaccine, and then hospitals and healthcare providers are going to be the second tier. Then at-risk public, that would be people who are at higher risk for contracting it, like teachers, grocery workers, people who work in the public all the time, and then people who have high-risk conditions, and then the general public after that. So that's pretty helpful. Until then, next slide, we have, I wanted to give this one kind of example. This was published last week in MMWR, that's Morbidity and Mortality Weekly Report by the CDC. It's a case study about how COVID can spread. So this was an actual wedding that happened on the 7th of August in rural Maine. I would hate to be the bride or groom from that wedding, but thankfully they weren't named. In a town that had no cases of COVID-19 to date, so this was in August, the county had only had a couple cases. The wedding had 55 guests. They were at a facility that was indoors. Their temperatures were taken, and they had a screening procedure as they walked in the door. The people who worked at the reception facility wore masks. The people who attended the wedding reception did not. There was one guest who did not have symptoms at the time but developed symptoms the next day and tested positive the next week. Out of that wedding came 30 cases of COVID, that one attendee. And then that led to 27 cases in the local community. One of the wedding reception guests that got sick had a mother who worked in a long-term care facility, and then she got sick, and she went to work one day with symptoms. Out of that exposure, there were 38 cases in the nursing home and 6 deaths. So we're talking a couple degrees of separation even. And then there was a reception guest that worked in a correctional facility, and that person developed symptoms, went to work 2 days while they were sick before they got tested, and out of that came 82 cases in the correctional facility. So from the one wedding with 55 guests, we have 177 cases ranging over 200 miles and 7 deaths. So it really can spread like wildfire. That's why we limit gatherings and events. It is a big risk factor for the spread of COVID-19. And then my last slide is, until we have better means of prevention with the vaccine, really SMASH is our acronym, S would be social distance, at least 6 feet apart, mask wear around anybody who doesn't live with you in public and in private, avoiding crowds and gatherings. That would include parties, get-togethers, carpools, crowded restaurants and bars, sleepovers for kids. Avoid these things. Stay home when you're sick. We have a big problem that COVID is often mistaken for just little cold symptoms, sinus infections, and a lot of people come in saying they just have allergies, and then they find out they're COVID positive. Get tested if you have symptoms. Just do your 4 days at home and wait for that test to come back. It really is okay. And then wash your hands, sanitize frequently, and disinfect high-touch surfaces. So that is Smash COVID. That is all I have for today. Thank you for your attention. I know this was long.
I have just a couple questions. You talked about common threads. What are we finding? What are the common threads locally?
Right. So our common threads have been mostly get-togethers. I'll use a personal experience. We were invited. I'll have my admission. My family actually, we had COVID last month and have recovered uneventfully. I could spend 10 minutes talking about that alone. It was an interesting experience. But we, as a family, had been invited to a party, a retirement party that we did not attend because we were not ill and we are not attending parties right now. But out of that party came 6 cases. And that is kind of what we have been seeing. People got really tired of not getting together, and we are seeing a lot of infections that way. We had fall break, so college kids came home. That is a high-risk time. So college kids are at an age where they show very little, if no symptoms, and their parents are at an age where they're starting to increase in risk. So you get into the upper 50s, lower 60s. We definitely have hospitalized patients in those age groups. So in terms of holidays coming up and the end of semester coming up, if there are college kids coming home, I encourage parents to get them set up for testing right after they get home. Just kind of have them lay low and not be out and involved in stuff before they get tested, and make sure they don't spread it to their families and things. So those are a couple of the threads that we have been seeing the past month.
And the only other thing was you talked about some future modifications. What would trigger those? Because we're kind of in a,
Right. Well, I'd like to give, so when we're in red, we have to maintain our current executive order restrictions for an additional week if we go from red to orange. So if we get better, we still maintain our red restrictions for an additional week. I would like to see how things go over the next 2 to 3 weeks. If we are continuing, if we're starting to flatten our curve, to use one of our old phrases from the summer, then I'll be encouraged by that. If we are not stopping and we're still kind of heading toward this logarithmic increase in cases, then we're going to start looking at more restrictive measures than just the executive order. I plan to look at that before the December 12th order, before that is changed or withdrawn.
Questions?
Does that sound acceptable? Cool.
Thank you.
You're welcome.
One other question.
Certainly.
Getting back and then we can move on. You had said that, our hospitals are being sort of stressed right now, and that we have a lot of long-term health care infected. When you get into long-term health care and then you get into the number of people that are in the hospital, are there people from long-term health that are sort of sitting ducks? Are they then going to the hospital? And if so, what is the hospital numbers, net the long-term health care numbers?
I do not have that information in front of me.
I didn't think you would.
It is a proportion. and I'm not sure that it's even half of their current admissions, but I can get you that, I don't want to say for certain. I can certainly get you that data. That would be my epidemiology nurse. I bet she has that right on the top of her head.
I just think it's an interesting comparison to look at, because it,
As of this morning, we had, I think, about 65 hospitals were
Right.
hospitalized. 15 of those were long-term care.
15?
Yeah.
15, okay.
My
Okay.
epi nurse and
Yeah.
her spend a lot of time together. There you go, so a quarter
Thank
of
you.
them, yeah.
Okay,
Yeah.
I was just curious.
And real quick, I wanted to also thank Jessica. I know she's been working with Kurt every day, 7 days a week, and
9
I'm sure
months.
that's getting to be a real drag at times.
Thank you, yeah, she has been a real blessing to our department. Actually, our department has been just working so hard.
Yep,
They've been doing a
everyone.
really great
Everyone
job,
has.
so.
So thank you.
Mhm. You are welcome, my pleasure.
Thank you for coming in. Okay, we got 4 pages of business to get through here, so it's what happens when you can't have a meeting for a month. We're going to go into an ordinance establishing a local home rule fund for the receipt of certain pass-through forfeiture funds. This is second reading. So we approved this at our last meeting 45 days ago, I believe. So this is second reading. Throw it to the floor.
Motion to approve on second reading.
Second. We have a motion and a second on an ordinance establishing a local home rule fund for the receipt of certain pass-through forfeiture funds. Second reading. All those in favor signify by saying aye.
Aye.
Aye. Pose same sign. Motion carries. We have a request to approve COVID reimbursement claims. Vicki?
Yes,
Yep.
can I address that? This is actually exciting news for us. Before you today represents the final claims for direct reimbursement. These are for various items, PPE, the thermal scanners that we have out there, a request from the Porter County Library System. This will bring closure to our one of our CARES Act funds, in fact, the largest by far CARES Act program that has been a pretty big endeavor that has happened in our office in the past fall. So the total number of claims that are before you for direct reimbursement comes to $397,800, and with your approval, we will then reimburse the appropriations to these various agencies. And you might be wondering, well, where does that get us in terms of our CARES Act reimbursement? These claims came before the state made their big decision about how we are to apply for reimbursement. We submitted the big reimbursement representing our payroll costs, and just this morning we received that funding. So we are completely at our maximum of $5.5 million in reimbursement. There'll be just one other thing that we'll have to bring before your attention at next month's meeting, but this will put closure to this particular CARES Act fund.
Motion to approve.
Second.
We have a motion and a second. Any discussion? All those in favor signify by saying aye.
Aye.
Pose same sign. Motion carries.
Thank you.
Thank you, Vicki. Coronavirus Relief Fund written, Porter County Library System.
If this is in keeping with the claims that you just approved, the State Board of Accounts is requiring a written agreement with any subrecipients. And this is an agreement that was modeled after a statewide framework. So for audit purposes, that will be required for you to assign.
Motion to approve.
Second.
We have a motion and a second for Coronavirus Relief Fund written, Porter County and Porter County Library System. All those in favor signify by saying aye.
Aye.
Pose same sign. Motion carries. And then we have number 4 on the agenda is a final master list CARES Act direct reimbursements. And that's the big spreadsheet.
That's the big spreadsheet that includes all of the
Oh, yeah.
direct care reimbursements from this
Read it
program.
front to cover.
Motion to approve.
We have a motion and a second. Did I hear a second?
Yeah.
Yeah, we have a motion and a second for final master list CARES Act disbursements. All those in favor signify by saying aye.
Aye.
Pose same sign. Motion carries. Then we have, next up, number 5, we have a memorandum of understanding between the Porter County Board of Commissioners and the town of Porter, and this is concerning Bridge 149, where we're going to be moving, well, Scott, is this the one? Let me make sure we have a lot of bridges going on right now, so is this the one with the trail?
Pedestrian bridge,
Yeah, we have a pedestrian bridge that the town of Porter built 15 years ago. We have to redo the bridge now. Where their trail is and where the bridge needs to go is a conflict. So we've worked out over the last 4 months, we've worked out some agreement with the town of Porter that when we do the bridge, we'll rebuild the trail next to the bridge, so the trail will be there. Then I think we've also made some accommodations for them because they didn't have enough right-of-way to get their sewer for the town through and some other things. So we worked out a grand deal here to where we can get everybody going back in the right directions here. So I think is that the basis of the agreement, Scott?
It is.
I think
It is.
I know I get that other bridge confused with this bridge, the one up in Brummett, I think is.
Yeah, this is on Waverly.
Right, so.
Good project.
At the end of the day, there'll be additional right-of-way for the town, for any utility needs they need. The pedestrian bridge is now separate, will become a pedestrian bridge as part of the new bridge design. So we worked with the town of Porter to get through that, and then this was the MOU to memorialize it moving forward.
Motion to approve.
Second.
We have a motion and a second for an MOU between Porter County Board of Commissioners and the town of Porter concerning Bridge 149. All those in favor signify by saying aye.
Aye.
Pose same sign. Motion carries. I'd also like to point out, early in our stormwater meeting, and I know this is the type of stuff a lot of people really don't pay attention to, but the city of Portage in the meeting earlier just took over a good section of Porter County's stormwater drainage system, Robbins Ditch in Portage. There's a new subdivision coming in that affects that ditch, and since it's in the city of Portage, and this development is impacting it quite a bit, the Porter County Board of Commissioners, along with the city of Portage, worked together to come up with relinquishing that regulated drain to the city of Portage, to where now they can take care of it because their funding mechanisms work better for them to take care of all of their own stormwater, and Robbins Ditch runs quite a bit through Portage. So I know these little things sound small, but from a county's perspective, they're really big, because what we're doing is we're sort of getting things in the right place for the right units of government to be able to manage them properly. And I think that these are the kind of things that I think in the past were always just sort of looked over, and I know this board has taken a lot of time and effort in trying to clean up a lot of these things. The good side is that we're cleaning them up. The bad side of it is they take a lot of time and a lot of discussion and a lot of back and forth to where we finally get it to today to where we can actually act on it. So that's just from soup to nuts there, just for everybody wishing to stay tuned. Up next, we have a resolution of the Porter County Board of Commissioners and the Parks Recreation, Porter County Parks Recreation, for the transfer of real property concerning the zone of wildlife. Scott, you have gone through all this, I'm sure?
Yes, I have worked with Attorney Hollenbach, and we've got together this resolution to transfer the property from the Porter County Commissioners to the Porter County Board of Parks and Recreation. This is the resolution that the Park Board has already reviewed and approved, but this is just the official documentation to memorialize what the Commissioners and the Park Board wanted to do with the property, which is basically transfer it within another unit of county government to the Park Board for them to be able to manage and maintain the wildlife sanctuary. Also, that's not part of this resolution, but was part of this overall situation, was that the Park Board was able to procure additional funds from the council this year during the budget session to help in the maintaining of the wildlife sanctuary, and then also the Commissioners had within their budgets allotted some dollars also for the maintenance of the wildlife sanctuary. So I believe
kind of the goal. We've been working on this for a while. The goal was to end up with the Zona Wildlife Sanctuary in a place that, or with a department that was better able to manage and maintain it more in line with their normal departmental goals, and then also to identify the appropriate funding and have that set aside so that it could be funded. This resolution is based upon the Indiana Code 36-111-8, that when we're transferring property between governmental entities, and I think it's all in good order. It's actually two parcels. There's one large parcel, and then the second parcel is a small parcel that's basically the ingress and egress off of 900, I believe it is. If there's not any other questions, I would recommend approval.
Motion to approve with comment. First of all, I'd like to thank the Parks Department for taking this on. Back in the late 90s, when the commissioners when they were approached by the Zona family to inherit the property, we did so with the thought, with the crest, it was going to be a wildlife sanctuary. Somewhere in the early 2000s, it was allowed to progress into more of a park property. Because if it had remained a wildlife sanctuary, there would not have been nearly the amount of funds needed to maintain it as there's going to be now and in the future. And that, I think, is really the cause of the issues that have developed over the last year or so, the last 10 months or 12 months, whatever. And this should solve the problem. I truly believe that if the county health department, the county parks department is allowed to do their job, that property in the long term is going to certainly benefit more than it is today. So thank you again.
One of the things we're going to do in 2021 is integrate this property into our master plan.
Right.
And that will be a process where we revisit the issues, Jim, that you're bringing up, and find where this, I think we all have the gut feeling that this is the department that should be responsible for this property. But what that will mean and how it will evolve will be part of where it fits in our master planning process.
Well, for me, you've got to be able to do your jobs. You've got to be able to manage that property as you see fit, which is we hire degreed professionals to do that around here. If they're allowed to do their jobs, I'm certain that property, in the long term especially, is going to be much better off.
Well, again, this board's responsible for roads, drainage, buildings, a lot of other things, and this just does not fit with what we're doing. And we do not do programming. Any programming we do stays in Memorial Opera House, it stays at Expo, it stays in those things. So for us, it was sort of a fish out of water in our department, and this is the right thing to do because the Parks Department does do programming for these type of facilities. So the right fit at the right place. It just took us a little too long to get there, but COVID and just changing things that have been different. As we know, change is always a tough pill to swallow up here. So, it's the right thing to do. I'm glad we finally got here. I wish we didn't have all the angst that went along with it, but we did. With that, I'll call the vote.
Yeah, I mean, at the end of the day...
Second first.
Yeah, that's right. We need a second.
At the end of the day, we want something that is valuable to the residents and something that respects the wishes of the original owner, Mr. Zona, and I think we've got that here. So,
all those in favor signify by saying aye.
Aye.
Aye. Pose same sign. Motion carries. Thank you, Dave.
Thank you.
Next up, you're going to stay right here.
Right here.
Next up, we have a resolution of the Porter County Board of Commissioners authorizing the submittal of a stormwater improvement grant to the Indiana Office of Community Rural Affairs for the DLACD.
Motion to approve.
second.
Have a motion and a second. Any comment?
I just wanted to say I've got two board members here from VLACD that are so appreciative of your willingness to do this. Walt and Nancy are both here, and we're looking forward. The application will be filed on the 20th, and we're told we have 5 other projects we compete against in a numbered priority, and we'll see if we can get enough points on their numbering system. But thank you for supporting the project.
Good luck, I hope you get
Yeah, good luck, because I know there's a lot of, that's a good thing. I'd like to see that go through up there. That could
Thank you.
really help that area.
Yep.
Okay, next up, did we vote? No, we didn't.
Well,
Thanks,
And
Melanie.
if possible, I need, because I've got to get this to the person who's filing it, if you could sign this now.
Yeah, you're always good at chasing us down, so we'll get it signed for you. I promise.
Thank you.
All right.
Put it in front of me, I'll sign it right now after we vote
We got
on
to
it.
vote on it first. All those in favor signify by saying aye.
Aye.
Aye, pose same sign. Motion carries.
Thank you.
Yep. You're welcome, Walt. Remember that. Okay, next up, we have 8, 9, and 10 on the agenda. I've been informed by our council that we can do all 3. These are resolutions. Scott, you want to give us an update on what these are here?
Yeah, we have the Commissioner Certificate sale coming up here in early December, and we have 3 different resolutions individually done, one for the Falling Waters Conservancy District, one for the City of Portage, and one for our own Porter County Stormwater Management Board. All of these are small parcels of property. The one in Falling Waters is within the Falling Waters Conservancy District, and is frankly as part of the Conservancy District and subdivision stormwater system, so that is a good fit for them. They need to have that property to continue on. Then the City of Portage has a piece of property that has also made itself to the certificate sale. This would transfer that to the City of Portage, as they have indicated that they would prefer to have that. And then also our Porter County Stormwater Management Board has gone through the list of available properties, and that those parcels that they believe they would need for drainage issues, or 100 South for that matter, were put on. So all of these are individual parcels of property going to either the Falling Waters Conservancy District, the City of Portage, or our own Porter County Stormwater Management Board.
So there you have it. So 8, 9, and 10 we're voting on together. So make sure we understand that on the motion.
Need a motion, Mr. President?
Yes, sir.
Motion to approve?
Second.
We have a motion and a second on 3 resolutions, as noted on the agenda as item 8, 9, and 10. All those in favor signify by saying aye.
Aye.
Pose same sign. Motion carries. Thank you. Next up, we have a request approval by Jerome Zakora to continue renting 24 acres of county property located at 303 West County Road 400 North, which is west of the Norfolk and Southern Railroad tracks at a rate of $150 per acre for farming purposes. Mr. Sikora has already given the county a check in the amount of $3,600 for 2020.
Motion to approve.
Second.
We have a motion and a second. All those in favor signify by saying aye.
Aye.
Aye. Pose same sign. Motion carries. Okay, now we're going to get into some pay apps. I know it looks like a lot on here, but we're going to try to rifle through them. First of all is 157 Franklin Street. We have Continental Electric. This is pay app number 15 for electrical work, and the remaining amount left is retainage, so we'll throw that for 157.
Motion to approve.
Second.
We have a motion and a second for Continental Electric. All those in favor signify by saying aye.
Aye.
Aye. Pose same sign. Motion carries. I'd like to give everybody an update. We're going to be probably moving, when do you think, Scott? We're still working through COVID right now. It's really hard to move people into new buildings and stuff when you have COVID going on. I know the furniture is on order. It should be coming.
We've gotten some of the furniture.
We've gotten some of the furniture. I knew it was getting close to coming in. So, be aware that in the, once we get through the COVID and we figure out a plan of how we can start moving these departments into that building, we'll certainly be putting that together, but a lot of work to do yet, too. And then we also have to move 911 yet, too, which will be a monumental task as well. So, and I know that some of that equipment's been ordered if not most or all of it. So we're getting close to inhabiting 157. I believe that child support is already in their space, and they have been in there for over 45 days now, and I know they've moved in nicely, so we're slowly taking residency in that building. So look for more things to come, and hopefully, we can get everybody moved in and situated through this pandemic. Next up is North County Annex. We have some pay apps here. What we're going to do is pay apps 1 through 12 we can do in one motion, and then 13 and 14 will have to be separate, because these are just pay apps. 12 is?
So is it 1 through 11 then?
1 through 11, I'm sorry, I didn't see this.
Mr. Chairman, I motion to approve pay apps 1 through 11.
Second.
We have
County
we have a motion and a second for North County Annex pay apps, items 1 through 11 on the agenda. All those in favor signify by saying aye.
Aye.
Pose same sign, motion carries. And I believe, Scott, we have pretty much, where are we at on moving in up at North County? I think
Everybody's moved in pretty much to their current locations. The third courtroom is now open. Some furniture's on order to be able to stock that out. As there's no permanent court going in there at this moment, the clerks are where they are, they're supposed to be, the prosecutor, probation, the courts themselves, the health department, the assessors, and the community room has been, up until recently, was being used for voting.
early voting, right? Yeah.
Everyone is pretty much where they need to be up there.
Good. And that's good to see we were able to use that community room for early voting up there, too. Worked out nice. Okay, number 12, Pangier Corp. This is change order number 4 for $50,547. This is to revise brackets, reinforce existing bearing wall at entry, additional knock boxes for fire chief, additional cabinets in prosecutor's area, and counter for witness stands. So it looks like we had some miscellaneous change orders all wrapped up into number 4. So I'll throw that to the board.
Motion to approve.
Second.
We have a motion and second for change order number 4 for Pangier Corp. All those in favor signify by saying aye.
Aye.
Aye, pose same sign, motion carries. State Line Fire System, this is a change order number 1. This is a credit in the amount of $2,286.
Motion.
Second.
We have a motion and a second for a credit of $2,286 that comes back to the county. All those in favor signify by saying aye.
Aye.
Pose same sign, motion carries. And then the last one, Kleckner Interiors, change order number 2 in the amount of $22,407 to provide drywall repairs on existing walls and clerk probation areas and bulkhead revisions for room 130. I think that's the additional drywall where we had some mold and some other things that we went in and eradicated and tore out a bunch of stuff, and now we went back in and fixed it. And that's what you get into with these older buildings when you rehab them, so I'm glad we were able to fix that properly.
Motion to approve.
Yep.
Second.
We have a motion and a second for Kleckner Interiors, change order number 2. All those in favor signify by saying aye.
Aye.
Aye. Pose same sign, motion carries. All right, got through that. Next up, Sheriff Reynolds. We have an ordinance here to receive funds from the State Homeland Security Grant in the amount of $214,375 to replace robotics platform for explosive, and this is second reading, so I'll just throw this to the board.
Motion to approve on second reading.
Second.
We have a motion and a second. All those in favor signify by saying aye.
Aye.
Pose same sign, motion carries. And then, I see, now we got Northrop Grumman where we're going to go buy that thing there. So that's the robotic platform for explosive incident in the amount of $241,086.
Motion to approve.
Second.
We have a motion and a second. All those in favor signify by saying aye.
Aye.
Pose same sign, motion carries. Cindy Dykes, a first extension to hospital services agreements for Porter Hospital. Fee for morgue use, CT scans, X-ray films will remain the same. I don't think we have anybody from the coroner, but I think we talked about this with her at the last meeting, didn't we?
Motion to approve.
Second.
We have a motion and a second for a first extension to hospital services agreement with Porter Hospital. All those in favor signify by saying aye. Aye. Pose same sign. Motion carries. Next up, Anthony Stua, Tony, our 911 director. I'm going to keep going while you're walking up, Tony. We got Minor Electric. This is a 3-year maintenance agreement for conventional IP sites, track units, base stations, and receivers in the amount of $23,517.36. Could you put that in English for us?
This is going to be to continue the use of our tornado sirens and activating equipment that's being handled by EMA and the Weather Service, but this keeps all of our equipment operational.
Gotcha. Thank you.
Motion to approve.
Second.
We have a motion and a second for Minor Electric, 3-year maintenance agreement for conventional IP sites, track units, base stations, and receivers. All those in favor signify by saying aye. Aye. Opposed, same sign. Motion carries. Priority dispatch. What do you got here?
This is our emergency medical dispatch protocols and soon to be our emergency fire dispatch protocols. This will take care of us for the next 5 years as well.
Okay.
Motion to approve.
Second.
We have a motion and a second for priority dispatch. This is a pricing agreement for the annual license and services for 5 years. All those in favor signify by saying aye.
Aye.
Aye. Opposed, same sign. Motion carries. Haynes and Company, an agreement for mapping system which updates addresses with an annual fee in the amount of $9.95. Is that for CAD?
No, what this is a system that will provide us, all the county as well as the state now, with online access for registered numbers to properties throughout the county, throughout the state. So in the event that we don't have registered information from a location, officers or fire department wants to contact them, we have a method to try to see the most recent registered information.
Oh.
Motion to approve.
Second.
We have a motion and a second for Haynes and Company for mapping systems with updates for addresses. All those in favor signify by saying aye. Aye. Opposed, same sign. Motion carries.
Thank you very much.
How you doing out there?
We're doing very good. We've already been up and checked out the 4th floor for 911. We see the admin equipment in there. Send an email to let you guys know some of the updates. We are moving forward throughout COVID. A lot of steps, trying to make sure we keep everybody safe. Still doing a screening for our residents, and everything's moving along forward. I think we're going to be in a good spot Q2 of next year.
Yeah, well, we'll start talking about all the small details that we have to work through in relocating a 911 center. Never done that one before. That's a first. So
It'll be fun.
Should be interesting.
Appreciate
Stay
it.
live. We will. Thanks, Tony. Yeah. Next up, this is for the Emergency Management Association. This is our 30-day upgrade for the disaster emergency declaration and travel description. As we told you before, we have to approve this every 30 days. That keeps the lakeshore communities open for any grants or whatever.
Motion to approve.
Yep.
Second.
We have a motion and a second for the disaster declaration and travel restriction update. All those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries.
And Lori couldn't be here today, but we told her that.
Yep. And so we got an ad here, which will cost $6,500 for the... So are these two different things, or are they together? Is this 4320 part of the 6,500? Says which includes,
Yeah, I think that,
so we should probably just include the $6,500,
Yeah.
right? That's what we're approving, would be my guess.
yes, I agree.
Okay, let's make the motion.
So moved.
Second.
We have a motion and a second for the Expo Center, placing some advertisements in a wedding magazine. All those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Animal shelter in the front row. Morning, Tony.
Good morning.
Or afternoon, or I don't know.
Somewhere in between.
It's all day here.
So one long day,
Yeah.
November.
Yeah. So we got, what do we got? I'll let you
Okay.
talk about this.
We have an open-ended lease here for a new transit for the animal control officers. I believe the total monthly rental is going to be $490.54, not $449.
What'd you say, 490 what?
490.54.
Did you get that, Kathy?
Yes, sorry.
That's all right. Happens.
Yeah, that's correct, the total,
Yeah, the bottom number
Yep.
there, that's what I thought.
$490.54.
You don't have any pictures with you, do you?
Pictures, ooh. Right. Last page.
So I think when people recall, when we built the animal shelter, we had 4 trucks,
Very old.
very old, of which we scrapped one right at the beginning and took some parts off that and got the other one going. But now that, there it is, it's a Transit, so.
Yeah, it's a Transit.
It's a Ford Transit van, very economical for gas, and it for having to go out and drive around and pick up a lot of stuff, that's gonna come in real handy. But I think there's no question it's time to get
Yes.
some new equipment out there, and I hope we have some real fun with putting a wrap on that van too, because I think you could have some fun with that.
Is that all-wheel drive?
No.
I don't think so.
I don't think
no.
Transits are, no.
We will kind of planning on keeping one of the trucks, because we will need one in order to pull the trailer if we ever get livestock or something like that. I don't believe the Transits are capable of pulling a trailer that size. So we'll...
Well, I would like to have that discussion with you, because I
Yes.
think that truck that we're talking about is sort of beyond.
Probably.
We have other trucks
Okay.
within the county,
That's fine.
stormwater. We got trucks
That'll work.
galore around here, so if we need to help out and go pick up a
Okay.
trailer and go pick something up, I know our department heads around here, they're all pretty good group of people,
Okay.
so I think we can work that out.
That works for me.
I just hate us sitting on an old truck, paying insurance and everything else on it when it's really not needed.
Okay.
So, we're trying to manage our fleet a little bit better than what we've done in the past, so, that's just my recommendation.
I am good
don't know
with
if
that.
anybody thinks she needs to happen, I have it,
I don't know how bad it is. If you say it's bad, it's...
They're all...
they're all pretty bad.
Right at either over
Yeah,
200,000
then what Jeff is
miles
saying
or
makes sense. We got
really
trucks.
close. Yeah. They're...
We got lots of trucks.
Yeah.
Okay, that's fine with me.
Don't we, Bob?
I'm not gonna argue.
So, anyway, okay. I'll make the motion.
Second.
Oh,
We have a motion and a second for a new Ford Transit for the animal shelter. All those in favor signify by saying aye.
Aye.
Pose same sign. Motion carries.
Thank you.
Get a new truck.
Yay.
Thank you.
Thanks, guys.
Hi, Ray.
Hello, how are you?
Doing good, man. How you doing?
Doing good, real good.
What you got here?
All right, well, we have 3 proposals for the Porter County Courthouse to replace the boilers. One of them cracked this summer, so we need to replace them, and the other one is, it's working, but it's of age too, so might as well get them both at the same
Yeah.
time.
Motion to approve the
Second.
cheapest bid.
you know how old that boiler is?
11 years old. And they go
Should've got
about,
more life out of that.
yeah, we should have got about 15.
Yeah, but just so you know, Jim, we've been beating this to death for how many, since spring,
Yes,
because we found the heating problem right at the end of winter.
yeah.
And so we decided to look at some other ways to maybe incorporate and do some things to where we could sort of consolidate some of the hot water systems in there, and it's just, the building is just not set up to do that. But we gave it the old college try, didn't
Right.
we?
Yeah, we did.
I mean, we were looking for, because remember too, you know, when we move over to 157, there's going to be about 80 people or so that moves out of that building over to this building. So the current setup now is we have a separate hot water heater, you have a set for people washing their hands, you got hot water, you're running through the whole building. What we were trying to take a look at, was there a way that we could just have one hot water system that you could pull off everything? And with the number of people coming down the building, it wouldn't have been so mission critical, but it just didn't work, did it, Ray? We tried.
It would have cost more.
We thought we were going to save more money, but it turned out being the other way. So we're sort of back to the original program, and this is what we came up with. But I think, if I recall some of the numbers we were looking at last time, I think these are a little bit better numbers, aren't they?
Yes.
Yeah. So that's good. We took our time, but, so that, just a little bit of history there, if anybody cares to know. We gave it a whirl. So we have a motion and a second for Hill Mechanical Corp. This is AKA Precision Controls. All those in favor signify, for 114,776. All those in favor signify by saying aye.
Aye.
Pose same sign. Motion carries, and I'm sure they're going to get going on that right away, right, Ray?
Yeah.
Thank
We're
you.
already in the process.
Yeah, okay.
I didn't want to wait too long.
Yeah, I know, it's getting cold out.
Right.
Precision Control Systems, this is a proposal to install a, okay, tell me what you got going on.
This is a BAS system. It gives us online controls on it. We're off-site, and it also gives us alerts. So like on a Friday night, if the system goes down, we get alerted at like 59 degrees instead of waking up Monday morning to having a cold building.
Right.
So I think this is a good investment for the county, and that's the reason why I'm pushing for it, because this lets us have those eyes on even when we're not there.
And this is just not for the Valpo Courthouse, this is for all of our equipment and all of our...
It's tied into it, yes.
It will be tied in, so we can remotely adjust things from one source.
Correct.
For all of our buildings.
Just like we're doing with North County.
Yeah, we had it before with Johnson Controls, but we kicked them out
Yes.
because of, we won't go into that, but
Right.
this is the new improved, it's all web-based,
Yes.
no proprietary systems, it's, okay.
Correct.
It's what we talked about from day one going towards, so I'm clear now.
Motion to approve.
Second.
We have a motion and second for Precision Controls. This is a proposal to install a JACE network controller at the Valparaiso Courthouse in the amount of $11,309. All those in favor, did we do the motion?
Skip the door.
Do we need a motion?
Oh, we did the motion.
Okay, so this is the vote.
Yeah.
All those in favor signify by saying aye.
Aye.
Pose same sign, motion carries. Next up, Ray, what you got?
We'll do the Tri-State Door Solutions for the jail. That's for the Sally Port. That's for when the police department comes in and lets their inmates out. They have one door in, one door out. The exit door right now, the motor is just not equipped to replace that door, and the door is also cracked in a few places. It is original door, so we're gonna-
Motion to approve.
Second.
We have a motion and a second for Tri-State Door Solutions. Is this the one where the guy got
It
out?
wasn't fast enough to roll.
Yes.
Yeah,
To stop a guy from rolling out.
yeah, that's back
Is this
door.
going to be faster?
Yes.
It's a faster door.
It'll be the right motor for the right door.
What's the speed? I want to know the speed.
Turbo, bud.
Come on, Doug, what are we going to talk about here now? I remember. All right, so we have a motion and a second. All those in favor signify by saying aye. Aye. Pose same sign. Motion carries.
All right, then at the JDC, we have the heavy-duty range. We're spending a lot more money fixing it right now. So we talked with their department heads too, and we all agree that it's probably going to cost us less money in the long run just to buy a new range. It is about 8 years old, and we've been spending, like I said, quite a bit of money on it, probably half.
8 years old.
I think it's 8 years old right now. So
In these jails and these type of things, have you guys developed a series of laminated checklists or things to put out there to, that may be something that we want to take a look at in some of these, like in the jails where we got inmates and other people doing things. I think, because what I'm starting to see is we're just not getting the wear out of this equipment. And I know we're doing 3 squares in these things a day, meals,
Yeah.
but this equipment should be lasting much longer than that. I mean, a stove is, 15, 20 years, I would think?
Right.
So I think that, as much as we want to keep you guys from getting buried on stuff, I think that we need to put some things in place here to where, is it part of, is there a kitchen manager in these places? Is there someone that you can go in and check, give me your sheet, where you're not doing it, but you make them do it? And then it's just a matter of following up. It's checking the checker, right? So, that's my only caveat about buying this. We need to have a stove, we need to cook meals for these people, but how are we going to take care of this stuff going forward? And I don't think it's really, you're not there all the time. We need to push back on the people that are there all the time.
Right.
And give them some criteria that they need to, make them submit something to you, monthly, weekly, whatever it is. We're getting a report from the jail every week, so that should be part of that.
Okay.
Just my 2 cents. So,
Yeah, it should last longer than 8 years.
I mean, even if at the end of the day, we got to spend a little bit more to get a better machine that has a better warranty on it. I mean, this place is open 365. You know, it's never shuts down. These things are used all, the washers, the dryers, the stoves, the refrigerators. And it's just, I think sometimes it's to our disadvantage when we try to save too much money.
Well, I can pretty much tell you in the hotel business, washers and dryers and stoves and things like that, man, they're a commodity. And I got cheap dryers in some hotels that are still there 20 years old, but that's because we change the lint screen every load. We do the things that you're supposed to do.
Yeah, they're not doing that.
They're not doing it. Dressing the belts, doing all those things that you have to do to keep those motors running properly, and that's, these stoves are just big chunks of iron that you just got to keep clean.
Well, honestly, that management of that should be done internally with the jail staff.
Sure, clean up.
Should be looking at it.
Okay. So I'll make sure
Anyway, just
I'll make sure
throwing that
happens.
out there, so I'll open it up to the floor.
Motion to approve
Second.
that's the quote there,
We have
from Central Restaurant Products at $6,780.
and we have a second, so all those in favor to go with Central Restaurant Products for $6,780?
Okay, the next thing we
All
have.
those in favor signify by saying aye. Aye, pose same sign, motion carries. I forgot, I had a mental block again.
And the last thing I have is the EMS generator over there, 49 in Chesterton. It is not working, and we need to replace it as soon as possible. So we got the quotes. I was trying to get third, but with this COVID, I'm not getting that many responses, so I got two of them, and Lionheart being the best. And we deal with Lionheart.
Yeah, Lionheart is our maintenance company, right?
Yes.
Okay.
Motion to approve the Lionheart quote at $33,700.
Second.
We have a motion.
Yeah, I have a question. Why is that so high? When you
33,000.
consider what a whole house generator would cost, and that building is not very big.
It also does the tower there, which I
Oh.
believe is the 911 tower.
Oh.
Yep. So you have the
Well, that would
redundant,
make
the
sense.
redundancy
That makes
built
sense.
into it and everything else, so.
Otherwise, I agree with you. That's what I thought too, and so it is in the tower.
We have a motion and a second. All those in favor going with Lionheart for the Chesterton Highway Garage generator replacement? All those in favor signify by saying aye.
Aye.
Pose same sign, motion carries.
All right, thank you.
Thank you, Ray.
Thanks, Ray. Hang in there, man. Highway Department, I know they're not here, but they're basically saying they're accepting material bids for 2021. So if you have bids that you need to get into them, please forward them to the Highway Department. Okay. That's it. Next up, we have Bob Thompson. This is Development Stormwater Management. Morning, Bob.
Good morning.
First up, on development stormwater, we have an ordinance relating to Department of Development and Stormwater Management to include a fee structure for rural broadband. This is second reading. Attorney McClure, why don't you give us the rundown?
So on between first and second reading, we did have some contact with some of the broadband providers and had some collaboration on the proposed rural broadband ordinance that we, the rural broadband service as it relates to the permitting fees. We had a couple of meetings and some revisions. Ultimately, I think it's just a little clearer and getting more to the point of what we were attempting to do in the beginning, which was identify the rural area versus the non-rural and or the urban fringe, and then also to encourage that or to not be a hindrance to the proliferation of the broadband service out into our rural areas. This is a significant reduction in the total cost of the permitting fees, but again, it's because we are attempting to encourage this activity, especially in today's COVID world where broadband access is exceedingly important. The same core of the ordinance remains, or the proposed ordinance remains. It's 20% of the original fee. We've added the ability to be able to add a bond instead of paying the other 80% and then having it returned. And then we just cleared up some things as far as on the application when they're coming in to put the broadband in, and the service has to be able to accommodate the basic broadband speed. It can offer lower or higher speeds, but it has to have the ability to offer the end customer at least the basic broadband speed, which is 25.3, I believe.
Yeah, 25 download, 3 upload.
Correct. If there's any questions, I'd be happy to answer them.
So Scott, what this is it makes it more affordable to get broadband out to areas where we currently don't have it.
Correct.
For everybody concerned.
Correct.
That's not only the company that owns it, but it's also the resident who is purchasing.
Correct.
Okay. Motion to approve.
Second.
We
More
have,
important than ever right now.
Yeah, I agree.
yeah, we have a motion and a second, and all those in favor signify by saying aye.
Aye.
Pose same sign. Motion carries. All right. And then I think too, as we continue to move down this path with this ordinance, then I think, you know, Bob, we just need to make sure and stay in contact, because if we get into this and we start moving in a direction and some other things come up and we need to revisit it, let's raise our hand and revisit it, huddle up and, you know, keep going at it if we need to. Just trying to say, it's a lot of our work up here is never finished, even though once we put an ordinance in place, things evolve, as we've learned this year. Whether you know it or not, they evolve. Okay, next up, United Consulting. This is an agreement for the design services of Bridge 110. This is 600 East over Crooked Creek. The contract shall not exceed $324,700. Give us a little, what do you got here, Bob?
This is a group of 4 bridges that we received federal funding awards for fiscal year 2025. This is the design service contract, as Commissioner Good mentioned. This is, what you're going to see here is 3 of the 4 bridges on it. This is just for design engineering services only. There's going to be a contract later coming in for right-of-way acquisition and after they get through the major design points of this.
Motion to approve.
Second.
We have a motion and a second for United Consulting for a design service agreement for Bridge 110. All those in favor signify by saying aye. Aye. Pose same sign. Motion carries. Next up, we have United Consulting again. This is an agreement for the design services of Bridge 80, and this is 300 West over Cornell Ditch. Contract shall not exceed $291,120, and this is the same federal.
Same federal funding. I mean, when I say fiscal year 2025, it really could start up July 1st of 2024 is when would be our target for having this done for construction.
Okay.
I also want to point out that all of these bridges here, too, are on our list that are having to do one-year inspections.
With the state.
Correct.
On the oversight.
Right.
And are these the last 3? Are we getting to the end of the list? I always ask.
We are really very close to
Right.
being in the end of the list. We have one more that will be coming, I'm hoping in December for approval on that. That's up in Lenberg Road over Salt Creek in the city of Portage. And we just put in 2 applications for 2 bridges for fiscal year 2026. Those are at the bottom of the list, but that will end our list. But it's continuing.
It's evolving, because
Yeah.
as some get fixed, others go, you know, it's because we're behind, but we're catching up fast.
We
so
are
that's
catching
good.
up.
Okay, we did not vote on that, did we? So, we have agreement for United Consulting, Bridge 80, to the floor.
Motion to approve.
Second.
We have a motion and a second for United Consulting for design services of Bridge 80. for an agreement over 300 West over Cornell Ditch. All those in favor signify by saying aye.
Aye.
Aye, pose same sign, motion carries. Next one, a fun one. We have an amendment here to the original license agreement for NIPSCO for the use of the Calumet Trail for jogging, hiking, and bicycle trail. What do you got? What's going on with this amendment?
This amendment is because of the NICD double track project. They are going to be doing some reconstruction of the trail under the State Road 49 bridge there, because they have to move the trail back behind another set of piers on that to keep it away from the second set of tracks that are proposed to go in. So
Pinch point.
Right, exactly. So it's going to be moving the bridge, or the trail further north into the bridge, and it's going to be doing some work there. NICD is covering this with their double track project.
Yep.
But NIPSCO is requiring this amendment to the agreement for that, and NICD is in needing of this amendment agreement for their environmental report that they're filing now with Federal Railroad.
Yeah, we're on the downhill slide of getting the approval for the double tracking, and this is part of the agreement that we need to get done for that. And that, again, that re-engineering of that pinch point over that bridge on 149 is going to be done at the expense of the NICD project, not us. So that allows that to keep moving a little bit too. And I think that based on what we've been moving on and working on, this area, which that part of the trail, which we have federal funding for, which goes from 49 west to Mineral Springs.
Correct.
That's, we're moving and working on that, and I look forward to sitting down with NIPSCO and sort of looking at that agreement and seeing what we need to do to be able to build on top of that portion of the Calumet Trail there, that easement, not the Calumet Trail, for the Calumet Trail. So this is all good stuff, and it's one part of the NICD double tracking getting done, but it's also the beginning of us starting to work towards the Calumet Trail and bringing that to fruition. So that's what that amendment is for. So I'll throw it to the floor.
Motion to approve.
Second.
We have a motion and a second for amendment to the original license agreement with NIPSCO for the use of the Calumet Trail. All those in favor signify by saying aye. Aye. Pose same sign. Motion carries. Next up, we have Lockmuller Group. This is an LPA consulting contract for the replacement of Bridge 98 over County Road 600 North in Salt Creek.
Bridge 3 of 4 for our fiscal year 2025. This, again, is design engineering, and construction could start anytime after July 1st of 2024.
Motion to approve.
Second.
We have a motion and a second for Lockmuller Group. This is a consulting contract for replacement of Bridge 98. All those in favor signify by saying aye.
Aye.
Aye. Pose same sign. Motion carries. Next up, 100 South Project. What do you got here?
This is the acceptance by the commissioners of the plan set. We did have that around for the signatures of the commissioners recently, and that the reason was is to get it to the NDOT on a timely basis for review of the final tracings. Now, what we're requesting is the actual formal acceptance and approval of that plan set going forward.
Motion to approve.
Second.
We have a motion and a second for the 100 South project. This is the acceptance of the engineering plat set for that project. All those in favor signify by saying aye.
Aye.
Aye. Pose same sign. Motion carries. Next up, looks like we got a couple rezones here, so I'll let you take it from here, Bob. Why don't you give us the lowdown?
Okay, first one we're going to have up here today is, this is Plan Commission Resolution number 20-04. Petitioner is Dr. Taraj Tarabi, requesting a rezone from R1 low-density single-family residential district to OT office and technology district. This is located at 57 East US Highway 6. To be more specific, it's on the north side of US Highway 6, just west of the hospital and just west of also the Porter Business Park that is there. The Plan Commission heard this at their public hearing on October 28th of 2020, and recommended favorably of this petition to the county commissioners with a written commitment going forward on this. And the written commitment does have a couple of items on it which request that there will be no access to US Highway 6. There's a stub road in Porter Business Park that goes right directly into this 5-acre parcel that's proposed for the rezoning. The Plan Commission felt that that was adequate and said no access onto US 6, that they are supposed to access Argyle Way. Drainage review, we're to take into account the pond. There was a number of complaints that came in about the pond that is in there and spring-fed, and they were having problems with the drainage on that. So that would definitely go into our stormwater department for review, which all development plans do anyway.
Yep.
Site lighting shall follow the requirements of the Porter County Unified Development Ordinance. We do have also a dark sky initiative, I should point that out. So, and we do have a pretty strict code on that as far as lighting goes. There is supposed to be no fugitive lighting at the property lines. And development plan is to go back to the Porter County Plan Commission for a meeting for their review to assure that if this ordinance is passed with the written commitments, that the written commitments and our UDO ordinances have been followed. And those are the items within the written commitment that was forwarded up to the commissioners for consideration. The Plan Commission, like I said, recommended favorably of this petition by a 6-0 vote.
Okay, any comments from the board?
I'm really familiar with that area, and I just, and I'm not a big fan of rezoning for a lot of reasons, but I think that if you're familiar with this area, and I understand it's a clinic that they're looking to put in?
Mr. Tarabi is proposing to put in clinics for his, and
Right.
structures for his children,
Right.
Who are all doctors,
There's 4 buildings.
and there's,
Yeah.
right.
And I think that's a better, you have the hospital right there, and I just think that's a better fit. And if you're familiar with that area, it's highly unlikely that somebody would be investing in that property to build homes on it.
Yeah.
Because of low proximity to Route 6 and all that, what's going on there, today. So I don't have any issue with it.
I think my biggest concern was taken care of in the commitment with regards to the frontage road access. Because if you know right where that property begins, 6 sort of takes a little bit of a turn.
Right, it does.
And so I think having an access near that area could be problematic, just because the way 6 is lined up.
Correct.
It's not really the property's fault, it's just the way the road is. So with that commitment in there, I feel very comfortable with this. But we'll go through the public hearing process, and we'll find out if we hear anything new. So those of you who aren't familiar with the public process, the next item on the agenda will be handled the same way. So what we do right now is we pause the commissioners' meeting, and I've just opened up a public hearing. And what we're going to do is give 3 opportunities for someone to come up and speak against, and 3 opportunities for someone to come up and speak for. When you come forward, we ask that you come to either that microphone up there or that microphone over there. Just give your name and address, and then whatever you want to say it. But that's our process. So with that in mind, I'm going to give anybody first chance, opportunity to come forward to speak against this rezone. Please come up and give your name and your address, and then let us have it.
Certainly. Robert Thorns, 807 Tanner Drive. And really, we have a lot of concerns regarding the processes which are going to take place. We feel that flooding damage may occur. I think somebody else wants to get a little bit more in detail on that. However, it was stated by one of the gentlemen in the previous meeting that he said come X or high water, that the natural flow would be restored as it was prior to this road being put through the lake, which will assure also that with the additional asphalting cap going in, that this may put it back to its natural circumstance prior to its glacial days. I also believe a lot of people understand the natural flow of this is, it's not just a pond. We seem to be focused on one pond. It's mineral fed. It used to flow into the creek which runs behind my house. Another gentleman who's here, Terry D. as well. It feeds wetlands. It goes through other ponds. It goes through arteries and the tributaries, which then feed into Coffee Creek, which feeds into the Little Calumet, and this trail goes all the way out to Lake Michigan. So this impacts a lot of area. Not just,
Sorry.
Excuse me. It impacts a lot of area, if you will. And I'd like to see that addressed. The secondary thing I have, and I will try to keep this short, is that we were told basically that a drainage plan for, storm water containment would be put into place. We don't know if that's been submitted yet for review, but I personally, and I don't know about the others, would love to see approval of that and that it would be installed pre-construction, because there are a couple people here that have properties of lower elevation we already have a water problem with, flooding Tanner Trace right at Route 6, which becomes ice. When you pull off a 6, I slid on it in four-wheel drive, and if the flooding issue becomes worse, it could create serious incidences with people becoming injured or killed, God forbid. So I think that hopefully there will be a plan for that to be put in place, approved per your requirements, prior to start of construction, and from past history, hopefully timeline schedules will be put on these different stages of events, because historically it hasn't happened. Some of which I have if you ever want to see them, Marine Corps of Engineers, Porter County agreed to it, Wildlife, Fish and Game agreed to it, that since '94 have never been met yet to this date. So as far as restoring that equalization of flow to a natural extent, it's worded in there 4 or 5 places. We still don't have it. It's been turned into a spring-fed stagnant pond. It's a mosquito breeder. It's a health hazard, is what's been done to it. So I'll leave that in your hands, and I thank you for letting me speak.
You bet. Thank you for coming up, and we have those comments now on tape, and we'll certainly disseminate them to our stormwater department.
Thank all of you very much.
Thank you. Anybody else? I think we have someone else. Yep, come forward, give your name and address, and let us have it. We got one more here, sir, and then we'll get you next, okay? Good morning.
Good morning. My name's Don Trowbridge. I live at 805 Tanner Drive. I live at the lowest part where the pond is, and since he put that one road in that he's put in, he blocked my drainage, and of all this water's going to the pond that he's going to be putting into it, I know you have a drainage board to try to take care of this, but I'm the one that's going to catch it. And that concerns me a lot, because Mr. Travis has not treated me right, but that's different. But I said, I got water problems now because of the roadway and what he's done, and I can never get anything taken care of. The last meeting, they said they're going to send somebody out to see the problem. They not came out. And I'm still going to be fighting it. Because I know if he gets what he wants, but I think that roadway should be gone. His driveway goes back to his house because he's got a different way in, and clean that pond back out like it should be, where the water can flow, like it has for 100 years, till he put a roadway through it. And I'm the guy that's going to get flooded. I'm the lowest end.
Thank you. Anybody? We have another one over here. There's a microphone right here, sir. You can just, right there just come up there and give your name and address.
Thank you.
Mm-hmm.
Terry D., 809 Tanner. The plans that I've seen, I don't know if we have a topo here, but the plans that I've seen show all of the drainage from this property going straight into a retention pond. But it's not the retention pond. It's a spring-fed pond. And that goes, outflows, just like what Bob had mentioned, through my property, through wetlands, and everything along the lines. in my opinion, I don't see how a spring-fed pond can become a retention pond. I just don't see it being practical. On top of the fact that the lighting plot, if the building is up higher because of the terrain of Route 6, we're lower. So the lighting needs to be really fine-tuned because we'll see it. I see it all the way over at Porter campus when there's no leave. So, and that's at my level. Up here, it's a big difference. So I think that there's some specifics that need to be mentioned. Returning the pond to its natural state. Landscaping needs to be addressed firmly. And I think that those are considerations that need to be addressed by you guys, and we need help with that. So I thank you very much.
Thank you. Second call, anybody wishing to come forward to speak against this ordinance. Third and final call, anybody wishing to come forward and speak against this rezone. Okay, first call, anybody wishing to come forward and speak in favor of this ordinance. Good morning.
Good morning, Commissioners. My name is Tagir Arshami. I'm a principal planner with the firm of Arsh Group. We are a consultant to Dr. Trabi for this development. I just want to stress what the Plan Commission, what was basis for the Plan Commission's approval, unanimous approval of this petition. Not only it is an acceptable use for the area, it is also, Dr. Trabi has agreed to those conditions that would address all of these concerns that the residents have, whether it is a stormwater, whether it is access control, or whether it is architectural design. All of those three conditions are included in the written agreement. Dr. Trabi has already indicated that, or he has actually signed that agreement, and he's willing to address those concerns. We're happy to answer any questions.
Thank you.
Thank you.
Thank you. Second call, anybody wishing to come forward and speak in favor of this rezone. Third and final call, anybody wishing to come forward to speak in favor of this rezone. And with that, the public hearing is now closed, and we're going to throw it to the floor here for this board to take action. One of the things that I would like, sitting up here over the last 7 years, I always tend to hear a lot of things about when it comes to stormwater. I always hear a lot of things about what we did wrong in the past. Everybody's always sort of quick to pull that on us. I can tell you in the last 4 years that we've made a tremendous turnaround here at the county to make sure that these type of things that you folks have experienced don't happen again. And actually, one would say that we now have our own county engineer. This isn't consultants anymore. This is our people. So when we make these decisions and we go forward, it's all on us. It's no consultant. It's, nobody. And so I've always wanted to be in that position to where it's on us, because then the engineering's right and we're doing this right. We get a lot of criticism up here from a lot of developers saying that we're too strict, and that, we have one of the lowest release rates in the entire state of Indiana of how we release our water. And we have no interest in changing that. We want low release rates. We want to store our water. We want to make sure that everybody in the neighborhood lives in harmony, upstream, downstream. And in the past, we never looked at those things. We were always just putting out fires. And I can tell you this from my perspective, because I know our department up there, this is going to get a thorough vetting, and this is going to be looked at very, very closely, because we have commercial button up against residential here. So we better do our job right, and we better make it work for everybody. And I hear what you folks are saying. What I would ask you is, let us have the opportunity to show you that we can fix this and do it right. And I ask that of you as your elected official, but I feel very confident in where we're going in these, and I think taking a look at some of the problems that we've resolved over the last 2 years, this is very doable, and I think if we run into a problem, we're all going to be talking about it at some point here, if there is a problem before we go. So I hope that didn't come off as, I'm not discounting what anybody's saying, but I also know that we're in control of our own destiny now, and there were a lot of things that were done wrong in the past. I'm not going to sit up here and tell anybody that that's not true. It's true. But we now have a funding source, and we're going after this storm drainage because I tell everybody, the next big issue that we're all going to be dealing with in the next 25 years is stormwater. It's not sewer, it's not water. I mean, water's always a concern, right? But stormwater, and the county, we don't get into sewer and water. So our calling card is stormwater, and it better be stormwater, and we better do it well. And, I guess I'm backing up our department because they're the ones that are going to have to review. I have not seen any designs on this yet. They have a litany of things to go through before we even get to the point of this. It's just the rezoning has to come first, and we have to start, obviously you don't want to spend money on things. You spend money as you go. If you get turned down, you don't want to have all this cost involved. So I think Dr. Tarabi, I think this applicant has a hurdle that they're going to have to get over with this department and us. And I just wanted to sort of expound on that because we get beat up a lot on stormwater, but we're getting there. We're getting there. We have a long way to go, sir. We have a long way to go, but we're getting there, and we have the right people in place, and these engineers are ours. They're our people. The community is paying for these people that are overseeing this, and so I think we stepped up to the ownership piece, and we're taking responsibility. So I just wanted to say that. That was just my little spiel. Anybody else wishing to?
Congratulations on being more self-contained and engineered and controlled. I can see that's going to be such a benefit. So. For everybody.
And it's a win-win for everybody. And that's where we got to get to in this thing. And right now, we're still, but the good thing is if the things were done a long time ago wrong, and if we come back into this area, we now have the opportunity to fix it, and to fix it for good. And I think this board has sort of taken a lot of pride over the last 6 years. We've fixed a lot of things up here, and there's a lot more fixing that needs to be done, but that's why we're here, and we're committed. So it wasn't my rah-rah speech. I wasn't planning on going into that, but the reason I feel like I have to say something is because we've all spent a ton of time up here trying to fix this. I mean, it's been daunting, and it still is, and our department has too. So thank you for your comments, though, and it will be captured, and we will take these things to heart, and we will look at these things.
We want to earn your trust.
Exactly. That's how it starts. Appreciate that. So thank you. Anybody else?
Just as I stated earlier, is that I'm not a big advocate of rezoning property, simply because I think I think those properties are zoned that way for a reason. But as things evolve and times change, sometimes it is necessary. But I think I'm not trying to speak for either one of the other commissioners. I think that as I see it, our departments, the way that they're managed and the way that they're funded at this time, is our priority is the people who are already living there, not for the people who want to come to live there or come to build there a business or whatever. So we have your best interest at heart. So you don't have to worry about that.
And I would like to also invite any of the public here. 9 o'clock before this meeting at 10, 9 o'clock, our stormwater department meets before this. And sort of interesting discussions of some of the things that we're facing and dealing with now, and I think if more people tuned into those or came to them, I think they would see the body of work that board is doing, because, and that's us, plus the surveyor, it's the same folks. I think if you come to those meetings, I think people would get a real feel for, wow, these guys are really, they got a lot going on, and they're really moving the ball, and a lot of good things are happening. I think it would give you an insight into the discussions that we're having, and so I'm into transparency and all that, and, you know, I know a lot of people have a lot of things to do better than come to this at 9 o'clock on a Tuesday morning, but the work is being done, and I'm very proud of it. We still have a long way to go, but I think we've put a good dent in it. And remind you, this department has only been in effect for 3.5 years. I mean, so this is a startup. And if you take a look at what we've done in the last 3.5 years, I'm very proud of the amount of work that we've done. And what we're doing is we're sort of addressing the problem areas from the worst to the least. And we're still up here at the worst. We're still dealing with a lot of other issues, plus new developments and other things that come in on top of that. So,
At the end of the day, if the stormwater work wasn't done properly out there, that's on us. That's not on the developer. The developer answers to us. And that's the whole advantage of having our employees, having licensed engineers as employees, as compared to having to rely on a consultant. At the end of the day, there's just more accountability.
There's nothing wrong with consultants. Ownership's ownership. And if they're your people and you're sending them out there and this is what you're coming up with, you can't, you know, it's here. And that's what we wanted to get to. We wanted to take responsibility. And there are some engineering firms that we're still wrestling with that like the way that things were always sort of done. And I think they all know that there's oversight now and that we're looking at this real closely. And you know, Mike Novotny's our county engineer. He's sitting over there. He's a graduate from Rose-Hulman. You know, we got the best in the business as far as I'm concerned for that department. And I am not an engineer either. So I have to take trust and faith in what he's telling us. And we all have to find our comfort level here. And I'm all in. So you probably figured that out already. But
there's a new sheriff in town.
Yeah, we're trying. So sorry about that. I didn't mean to digress. And that wasn't a marketing ad for the stormwater department, but I'm just too passionate about it. So with that, I'll throw it to the floor if we want to make a motion on first reading. This is first reading. Second reading, if this passes, will take place at the next commissioners' meeting.
Motion to approve on first reading.
Second.
We have a motion and a second on first reading for zoning map amendment from R1 low-density residential to OT office and technology.
Including the, what do you call it, the things,
The written commitments.
The written commitments.
With covenants as
third
outlined in plan commission approval. There's your motion. We have a motion and a second. All those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Next up, we have another rezone. This is at 325 East in Morgan Township. This is a zoning map amendment from 1A, A1, General Agricultural District to RR Rural Residential District. Petitioner is Calvin Schneider. And this is also first reading. So might want to have that group come forward if they're here. Yep, there he is.
What's the next meeting?
December 15th.
At 10 again. And usually plan commission stuff is at the end of the meeting. So we'll see you back then. Thank you, gentlemen.
Hopefully it won't be as long as this one.
Yeah. Good morning. How you doing?
Good. How you guys doing?
It's a long one.
It is. Go ahead, Bob.
Yeah, go ahead, Bob, please.
This is Plan Commission Resolution 20-03. Petitioner is Calvin Schneider requesting a zoning map amendment from A1 General Agricultural District to RR Rural Residential. As mentioned, this is on 325 East, and it's on the west side of 325 East, just north of 150 South.
Correct. Oh, so this is further...
It's in Morgan Township.
It's further down. So 150 is where Whitmer's at, right? That's where Rick is? And so you're 325. How far are you from that intersection? Are you north or south?
North. Just north of the intersection on the west side. There's an existing house there. The Whitmers are doing a little small 3-lot administrative subdivision. There's an existing house, and then there's a vacant field on the west side that Mr. Schneider's proposing.
Okay. And how many acres is that?
How many acres?
21. How many? 4?
As far as
4 lots?
Mm-hmm.
4 homes on 21 acres?
That's some...
You live down there, Mr. Schneider?
I live in Creekwood, which is right around the corner from there.
Yep.
But you own the property?
Right. Yeah.
Yep.
Just recently purchased it.
Those are some big lots.
They are. My plan is, I did a house on 250 South, which is just east of 49. Those are 10-acre parcels.
Mm-hmm.
And so they did a house and a pool house and a nice pole barn. It's just kind of a real nice, setup for somebody that's wanting to be out in the country and have a pole barn, and can't do that in a subdivision, but the 10 acres is a little much. So they've got somebody farming the back part of it. So my idea was to divide this into 4 or 5-acre lots and run just a private road in to access the 2 back ones, and then have 4 or 5-acre parcels where someone could do a nice setup with those things in a pole barn and has a little bit of acreage.
Okay, we got another public hearing. So what we're going to do is suspend the commissioners' meeting and go open up a public hearing. First call, anybody wish to come forward to speak against this rezone? Second call, anybody wishing to come forward to speak against this rezone? Third and final call, anybody wishing to come forward to speak against this rezone? First call, anybody wishing to come forward to speak in favor of this rezone? Second call, anybody wishing to come forward to speak in favor of this rezone? Third and final call, anybody wishing to come forward to speak in favor of this rezone? And with that, the public hearing is now closed. We're going to open it up to the floor and hopefully take action one way or the other here. What are we doing?
Laura, you sit on the Plan Commission, South County Commissioner, what's your thoughts?
This is a good development.
All right.
Everybody on the Plan Commission
All right.
was happy with it.
That's good enough for me.
Motion to approve.
Second. We have a motion and a second for a rezone on 325 East in Morgan Township. All those in favor signify by saying aye. This is first reading. Aye. First reading, sorry. We will come back at our next meeting and read the second reading at our next meeting in December. So you're off till the next meeting.
All right. Thank you.
Thank you.
Thanks, Bob.
Okay, then we have an amendment. Next up, an amendment to the UDO establishing minimum requirements for raising chickens within unincorporated areas of Porter County. Yes, folks, we cover it all here. We're down to chickens now.
That's why Tom stayed.
Tom stayed for the chickens. He was waiting.
Bob, you want me to give the Reader's Digest version?
Sure.
Please.
All right, on parcels of land, so we spent some time on
Come on,
this.
Doug, get your pen out.
Doug got to hear about this at Plan Commission, right? But basically, on parcels of land within recorded subdivisions, within our recorder's office that are 5 acres or less, we put in some standards. The idea was, we've gotten a lot of complaints about chickens. They're in that urban ring, that urban fringe. Most of them are in subdivisions that are butting up to one another. Some subdivisions are newer ones, say 15 or 20 years of age. Most of them have covenants that are dealing with the wildlife or the domestic animals at the house. Some of the older ones do not. We have some of these are in conflict because they butt up to each other or they're infill projects. So we're very careful and did not want to have anyone get confused on us restricting animal being here in Porter County in the unincorporated areas as a whole, and that's why and I'm spending some time here, as Doug knows, at the Plan Commission. I was sensitive to this issue, is that basically we're trying to get to the recorded subdivisions that are 5 acres or less with the lots. Okay, so that's where we were starting, not trying to be down in the middle of South County or Jackson Township or anywhere else that isn't fitting into this. But basically, if you're in those rings, you're in a subdivision, you're on 5 acres or less, it's basically, if you're less than an acre, 4 chickens, 1 to 2.5 acres, 6 chickens, 2.5 acres to 5 acres, 8 chickens are allowed. And we've gone through and dealt with the size.
Yeah, how many roosters?
No roosters. No roosters. No roosters.
That's the real kicker.
Well, that seems a little...
But we went in there and put in some things as far as the side yard setbacks and the parcel lines and the sizes of these chicken coops and then how, keeping care of them and what they look like. So we spent a lot of time trying to make sure that we were trying to thread the needle here as best we could, and we really are attempting to, and I do think this does do that. Just try to deal with the denser, non-city but yet urban areas that we kind of have some, dueling covenants and things like that of properties, so we can try to deal with
everybody happy.
Try to make as many people happy as possible.
We still have a lot of unincorporated subdivisions that are in the outlying areas of cities and towns, and that's what's caused, the guys down in South County with the big pieces of land, you don't want to, but then you get into subdivisions that are county subdivisions, and the one size fits all just isn't working. And I think that became apparent very much this year, because we got a ton of complaints this year on this issue, just sort of came out of nowhere. So we're trying to address it the best we can, and we'll see how it goes. Is this a first reading, too? So we're going to suspend the Commissioners' meeting again. We're going to open up a public hearing. Anybody wishing to come forward to speak against this amendment to the UDO? Second call, anybody wishing to come forward to speak against this amendment to the UDO? Third and final call, anybody wishing to come forward to speak against this amendment to the UDO? First call, anybody wishing to come forward to speak in favor of the chicken UDO? Second call, anybody wishing to come forward and speak in favor of this UDO. Third and final call, anybody wishing to come forward and speak in favor of the chicken unincorporated ordinance. And with that, the public hearing is closed. We'll now open it up to the floor and the board.
Motion to approve on first reading.
Second.
We have a motion and a second on first reading. All those in favor signify by saying aye.
Aye.
Pose same sign. Motion carries.
Chickens
Thank you,
are
Bob.
Thank you.
Last one, we got a request to hold teen court in Judge Drent's courtroom for the school year 2020-2021. Judge Drent has given his approval. Throw it to the board for action.
Motion to approve.
Second.
We have a motion and a second. All those in favor signify by saying aye.
Aye.
Pose same sign. Motion carries. And with that, we come to the end of our meeting, and no one here, the room is empty. So with that, other than Tom. So other than that, this board stands in recess. Have a great holiday. Thanks, Tom.